Greetings, dear participants, distinguished guests. Today we do start our fourth webinar on our topic. This is a series of webinars related to volunteering. We're happy to greet everybody today. Our today's webinar is facilitated in two languages. I every time speak about this. Here down in the Zoom, you can see a globe icon, which means translation, interpreting. That means if you push it, you will be able to see several variants. You may take part at the webinar in English, in Russian. You may listen to English or Russian. And today we have great interpreters, Maxim and Xenia. Thank you so much. And therefore, I will try not to make it all in a rush, in a haste, for the interpreters to be able to translate it all. So, as I told, today we have the fourth subset of volunteering track, and today we will speak about the plan of starting a volunteering service. And our track is supported by the fund, the Grace Trust. And we want to say thank you from the bottom of our heart to the colleagues who supported our idea to facilitate this volunteering course, where you will be able to really work out some stories on start of volunteering service. And we also will publish in the YouTube of the Paste Fund all the volunteering tracks recording. And just a couple of words about our fund, Paste. But before I will tell you about the fund, just initial information, please do write down in the chat, where are you from? Where are you now? And I will start. My name is Xenia. I work at the Paste Fund and I live in Spain, in Valencia, great city. And so please do use our chat to write in Russian, in English. It doesn't play a role. Everything will be translated, and we, with the colleagues, will interpret it all, everything which is in the chat. So, just a couple of words about our funds. We are a charity fund based, it's the name. We are based in the UK, and we are created and established to make different training programs for professionals in palliative care. We have a list of countries with which we work, or where we work. These are the countries of Central Asia, Caucasus, Eastern Europe, and Baltics. But we are also very happy when the participants from other countries are joining us just to listen to the webinar. So please do write down in the chat, where are you from? Where are you now? And today we will have so much interactive, and we will ask you also to ask the questions in the chat. Perhaps you will use a pen or a piece of paper just to write down some your insights, ideas, as usually. But again, do not be shy. Please ask your questions in the chat in parallel while the speaker is delivering on her topic. I would say it again because I see there are some new participants coming in. Therefore, translation. There is a translation button here. Please pick up the globe sign and then just take an opportunity to listen to it in English or in Russian. Our font Paste is working in two languages, English and Russian. Therefore, all of the materials that are published on our website, all our social networks, they are into languages. So, hello to Egypt. Thank you very much for participation. Thank you to Georgia. And here I wanted to present our speaker, our today's guest, who is an expert. And this is my co-moderator, Carolyn Lotz. Carolyn, hello. Greetings. Carolyn is the head of volunteer service. Volunteer service manager for the Galilee Palliative Care Centre in Greece. And this is a great honor for us to have you as a guest today, but not only as a guest, a part of our interactive webinar. And today, my co-moderator, my colleague from PASTE, Felix Pinto Baquerizo, is also with me, who is also writing down in the chat that he is living volunteering in Georgia, in Batumi, city of Batumi. Felix has a huge experience in work with volunteers for many years. I think he will tell also a little bit about himself. For many years, he was the head of the volunteering service, and he also used to help at coordination of all these projects and processes. So now I will let the floor to Felix, and he will just tell a little bit on the contents of today's webinar. How do we do it? So, Carolyn, now I think we have to give a moment to Carolyn. So, Carolyn, you may say now hello and just a little bit tell about yourself, please.
Okay. I'm so pleased to be here with you all today. I grew up in the United States, but I've been living in Greece for over 40 years now, and had the great joy and honor to be part of the building up of a palliative care program here in Athens, and have been the volunteer service manager since 2012. We opened our doors in 2010. So I'm very excited about this session today. I feel it's an honor for me to accompany you on this because I know it can be very challenging doing something so new. It takes some courage, especially in a country where palliative care volunteering may not be so familiar. So I just want to encourage you. I've been where you are, and it can be done, and it's very worthwhile. It's a very rewarding way to go. So it's a joy to be with you, and I feel sure that we'll make a lot of progress today, and you'll all feel a lot more comfortable by the time we finish this session. So thank you.
Carolyn, thank you so much for your entry also. And as to today's session, as Xenia told, we will have many activities. Any idea is important. We will be grateful. We understand that you are on your work, but again, if you have a possibility to ask it in the voice mode, so to say, please do it. But if you will share the idea in written form, it's okay, of course. But again, I think we may start and we may commence our session right now. So the first question of the agenda is, I think the next slide would be here. Yep. I want to ask you, just we've been through something already. We've been looking at the information of why do we need volunteers, all the legal frameworks, complexities. Experience was also shared experience by the London organization. And now, while we are trying to build up a plan which would work with your organization, what step in the starting of volunteer service would fit for you? So you've been listening to this, and what would be the most challenging step in the beginning? I have also a couple of ideas. I will speak about my fears also when I was thinking about this, like when I will need to do it from scratch. And I think together with Caroline, we will listen to your fears and your initial ideas. So Xenia is now working, writing here. Thank you so much, Xenia. I think to pick up the first volunteers would be the most challenging thing. Well, I would agree here. What else could be the challenge?
Феликс, давай дадим время нашим участникам.
So, Felix, we will speak about this with the participants. Please do write it down. What is the most challenging thing? And there will be the second webinar on our volunteering track when we've been discussing what are the documents to prepare. And by the way, there were so many questions at the webinar, like how to make your work safer in legal aspect. And I think legal aspect is very important when you work with people. It's very important also to provide for a certain security for you, for the volunteer, for your organization, for the center, and for the people, of course, who are in the hospice or at home. Caroline, what would you say? What is the most challenging when you were starting, like for the first steps, your first experiences, and how in Galilee there are perhaps some challenges or some ideas of how to overcome these fears?
Yes. I think for me, the most challenging, I was fortunate because I knew the director from before, both the scientific director and the overall director. And they were familiar with volunteering because they had both worked in the medical field in the United States at some point. Um, so there were some core people around that I knew would become good volunteers and would be kind of the leaven in the bread, to say. For me, the most challenging thing actually was to win the trust of the professional team, because volunteering is not organized here in Greece. None of the members of the interdisciplinary team have ever volunteered. And so it's not easy for them to trust patients, even for a visit or transportation, to volunteers that they're not very familiar with. So that was a challenge for me, overcoming that, winning their trust. And I believe one of the most important things in doing that, aside from just developing a rapport, was convincing them that we had very vigorous training for the volunteers. So our training program is 40 hours that we do over a period of 8 months. And
А вы скажите в первую смену, знаете, подойдите к Гульальдун Генбековне и ей скажите об этом, если она разрешит. Но тоже только один день, все через нее. Кстати, как у вас староста?
I think somebody did not close the microphone.
Ага, все.
We beg your pardon, you may continue, thank you.
Yeah, no problem. So getting the word out about palliative care was challenging. That's something we worked on a lot, just consciousness raising in those first years, and kind of wooing the professional team to trust us, to see that we can do a job, and that, of course, we don't take initiatives on our own. Whatever we do related to the patients comes from a request from the social workers. So just working together in that way and seeing that, in fact, everyone is well trained, is not going to step out of line, was very important.
Yes, I would agree here. And perhaps, yeah, thank you for this entry. Yeah, we understand that there is a loaded day today, but again, we are now showing the presentation again. And I think we will today speak more about these topics. And again, your comments, your reactions, please do write down in the chat box. So thank you so much. And from myself, I would say that, Caroline, I would agree with you, because trust to the organization of professional community is a constant problem. You have to approve it every time. You have to work with this. You may not leave it out, because every couple of months I did a special presentation for the medical staff. Like I was telling, what is the need in volunteers, how many hours did they spend in the hospice, and just again and again I needed to show it, that this is also a part of the plan of my work. And as to the Xenia, I would support her also here, because when we speak about the documents may be a challenging thing, because the volunteers may be great, brave people, beautiful people, they want to make something good. But the documents play a huge, decisive role. You may not do anything without documents, but it's great that we had a webinar about this, and you may also look into the topics, because regulations, rules, they have to be there. They are obligatory. We're working on the edge, so to say. We work on the edge between the organizations, people, the charity, and this is also having its toll, so to say.
Right.
Yeah, Carolyn has told that there are more details about the 40-hour training, because you told about the training initial. Perhaps we would also somehow take a hack on this topic also, but a bit later, of course. So let us put a little bit fantasy, and let us together try, on the basis of the next slide, together to make a certain plan and just to fantasize, because partially, together with the listeners, we've been discussing all these aspects. But let us try to do it together, because it's all every time was just in different parts of the training. Like, let us connect the dots and work on every part of the plan, like a classical scheme. Look at the goals, at the steps, at the participants, and the resources that we have, of course. And then later on, we will work with the other part. So, next slide. Yeah. So, goal. Let us speak about the goal, because several times we've been speaking about this, but again, let us add this as a topic. Like, what advantages do you anticipate from volunteers? That means, why do we need to have volunteers? What is the use of volunteers, so to say, and their influence and participation? You may use the chat box or use your voice. If you speak verbally, it would be also great, like a human hint, so to say, in our participation. And again, from myself, there is the question, why do you need this? This is the eternal question, like, why do you need it's a great, important question for your life, even like when we speak about volunteering, also because everybody say, "Yeah, let us have volunteers." Great, very often we speak about this, but what for? What is need in volunteers? What do you need from them? You quite forget about this. What would be the task? Like just to be? Well, it doesn't work. There should be something like one, two, three, four, five items that volunteers can do. And Carolyn, by the way, I wanted to ask you, Carolyn, how would you get an answer to this? What would you say? Why do we need volunteers? What is the goal?
Well, I think I would first point out that since 1968, when Cicely Saunders started palliative care, there have always been volunteers involved. And certainly in all English-speaking countries, there's always been volunteer programs. And I think that has developed in other countries as well. And of course, one aspect of it is extra care and better quality of life for the patients. Being able to visit them, keep them company, people who are lonely, transporting them. So there is that aspect to it, and we can talk more about that later because there's issues of who actually will do those things. I think it's also important to point out to the management that volunteers do many kinds of practical help to the team. So it can be transporting the dirty laundry from the hospice and bringing back the clean, or taking food to patients who are in need, even cleaning sometimes the room of the patient in his house for home care. There are many things that they do to help the whole organization, and one of those is fundraising. I don't know how it is in your countries. Here in Greece, there is no public support for our palliative care center. We get no money from the government, and no help whatsoever. So that means a lot of money has to be collected, donations made, but the volunteers do many fundraising activities. We have a bazaar every year, and it is very popular. Many people come, and at this point, it makes about 100,000 euros a year. They take a box to funerals whenever somebody asks for them all over Athens. And people put money in there in the memory of their loved one. Again, another 100,000 euros comes from there. And then many other smaller things. So this is something that is very appreciated by the management. They'll see their own interest in a way, in addition to having better quality of life for the patients and their families. I think this is a very significant thing to stress, the practical helps and the help in raising the funds for the program to go forward.
Кэролин, спасибо вам большое. Коллеги делятся, что в Сербии тоже нет государственной помощи. И спасибо коллегам из Сербии, если вы
There is no
можете написать в
public
чат чуть
support as
больше
well.
и,
And
может быть,
dear
взять
Serbian
слово и
colleagues, you
рассказать
can write
тоже
more to
про
the
ваш
chat,
опыт,
and you can
про
say a few
и
words
если у вас
about your
волонтерская
Serbian
служба, или,
experience,
может быть, что
whether
вы
you have a
хотели, чтобы у
volunteer
вас появились
service or
волонтеры,
you would
тоже,
like it
пожалуйста,
to
не
be in place.
поднимайте руки,
So raise your
мы дадим вам
hands,
право
unmute
голоса,
yourselves,
или
and we
напишите в
certainly will
чате.
be happy to
А я
hear
хотела
from
спросить
you.
у
And
Кэролин
I would
по
like
поводу
to ask
фандрайзинговых
you,
мероприятий.
Caroline,
Если я
about
правильно поняла,
fundraising events. If
то
I got it
волонтеры,
right,
которые помогают вам с
volunteers that
фандрайзингом,
help you
они
with
собирают какие-то
fundraising,
мероприятия или,
they
может быть,
organize
находят
some
какие-то
events
контакты частных
or
лиц
they
или
find
коммерческих
some private
организаций, которые вам
contacts or contacts of
помогают
commercial
с
organizations that can
бюджетом
provide financial
вашего
support.
хосписа. Если бы вы могли с нами
And if you
поделиться,
could
мы
say a
были бы
few
тоже
more
очень рады,
words
и я
about that,
думаю,
we
что
would
для
be
коллег
very
это тоже
happy.
может
And I
быть
think
ценно,
it will be
потому
very
что до
helpful
сегодняшнего
to hear
вебинара у
about it
нас
for
не
our
звучало,
colleagues, because
не звучали
actually
волонтеры в
we
связке с
have
фандрайзингом, и
not
это безумно
touched
интересно.
upon that topic, volunteers helping with fundraising. Thank you very much.
Right. Yes,
Over
well,
to you.
We have one lady who has taken on the responsibility, and some volunteers work for her. So they may organize a concert, find some musician who's willing to do a concert for free, which we had this past year, a well-known person in the ancient theater. And so many people came to that, and he gave all the money from the concert to Galilee Palliative Care Centre. And there are other events. There's a gala dinner where people paid quite a lot of money to go have a dinner and listen to a talk. There was some music as well, some ladies playing violin who were actually all cancer patients. And so there are events like that, which are led by a person, but the volunteers help to organize it. The things that the volunteers do on their own are basically the bazaar every year, which is a great deal of work, and going to the funerals that I mentioned, which are all over the larger Athens area. So it's actually very time consuming, but we've seen that it's very lucrative. And it also gets the word out about palliative care, because one of the main things volunteers need to do is to be advocating for palliative care. There's still so many people who just haven't heard of it and don't know what it is. So there's always that double benefit in raising money and getting the word out about palliative care. I hope that answers your question.
Yes, thank you, Carolyn, very much. And let me read another message from the chat. It's going to be translated for you. Volunteers provide support. They help in household matters. They help not only patients, but also to their families. Thank you, Yekaterina. Thank you for saying, referring to the psychological support. And Felix, I would like to give the floor to you. I remember our trip to Georgia, and we had a great visit to the Georgian hospice fair flight. Can you share a bit of the experience in that country and what is going on there with fundraising? Fundraising is very well developed there, and if there are any Georgian colleagues with us, let us know. You are doing a great job, and they hold a lot of fundraising events and even auctions. It's all organized by volunteers. They sell pictures, they organized events, dinners, etc. It is very popular. I think they hold such events once or twice a year, but it is a very important component of their work, and indeed it's very helpful. As for fundraising and fundraising done by volunteers, maybe we digress from our topic, but this component is very important, and volunteers are very helpful in fundraising, although it's a sensitive topic, and we have to be very cautious here because you see, volunteers help you with financial issues, but that also can have an impact on how people perceive you. But again, volunteers can be very creative in finding or attracting funds, but also finding some other sorts of sources of help. But again, you as organizers have to be very cautious when you engage your volunteers in these types of activities. And again, we have talked about various aspects of volunteer work. Thank you, Caroline, for sharing your experience. And you have said a lot about the services out of hospices. And this is something what we would like to do at PACED, and because it is an outstanding issue at many hospices. So it's great that you help people out of hospices at homes, and that's something very important. So we understand our goals, and I think that our Serbian colleagues also have heard a lot of important matters for them, and thanks for sharing the information. So what else do we see in our chat? Okay, let's move on to the next slide. I'm not sure we will be able to cover everything, but we will try at least to touch upon some matters. Okay, here you go. What will be your first step? What needs to be done in the next week in terms of launches? Well, first of all, you're already here at this webinar. This is your first step, and that would be helpful, I'm sure. I can say on my part that for me it's very important to understand what would be my target audience. It's important for me to understand where I work, what is the context around that or the environment, because I need to understand who I will interact with. I need to understand who will be my volunteers, and once I understand that, I will understand what I will do. Let's say that I find myself in Latin America tomorrow. Oh, Sophia, you're here. Thanks for joining. Okay. Ksenia, you have a comment, correct? I have never coordinated volunteers, honestly speaking, but I probably would make a plan for every month that would describe what I will do, how I will act, who I should coordinate my actions with. Let's say if I just work in a hospice and I'm full of enthusiasm and I want to do something and I want to organize volunteer service, where would I start? I probably would come up with 2 roles for volunteers, and I would test my hypothesis in terms of how the volunteer service may look like. That's probably where I would start. So I would come up with a plan or action plan, because I think when you put it on paper, you get a better vision. And colleagues, we kindly ask you to share your opinions. Imagine that in 1 month, you will welcome your first volunteer, you will open your doors for the first volunteer. What would be your first step? Or maybe you have already made this step. Thank you, Ksenia. Getting back to Carolyn. Carolyn, can you tell us what were your first steps, or what steps are you taking now, or whenever you join a new place, what is the first thing that you do? And can you share your experience in this regard, please?
Sure. Well, we started first at Galilee. We had a home care team, and we had what the volunteers did was to start a daycare center. This was with the blessing of the management team. So the volunteers started the daycare center for patients who are well enough to come and need some socializing and activities. And so that started 1 day a week. At the same time, with the help of a social worker, we transported some patients who had no way to get to their therapy or to their doctor. And then, of course, when you get to know the patient, that turns into a relationship. And so we would visit that person also in their home. So this was really the beginning. We had a group of about 20 good volunteers almost from the beginning, who were well known to me and to the director. And so we started out in these ways, which for me is a little surprising in a way, to start out directly with the patients, because we had not done training yet at that point. So as I looked into training programs, I landed on the Palliative Care Volunteer Training Resource Kit, which is from Victoria in Australia. It's an excellent program. I translated it into Greek, and this is what we have used ever since. So it was the next year, actually, that we had our first training. And so even though we had been doing some of those things the first year, with the help of and supervision of a social worker, we did our training and continued to do those things. So now nobody can do anything until they have finished that training program. That is a prerequisite, especially if they want to work with patients. Does that answer your questions?
Yes, thank you very much. Thank you, Carolyn. We actually had a question in the chat about your training. Could you dwell on that? Could you say a few more words about your training, please?
About my training?
Yes, training for volunteers, yeah.
Yeah, so it's a program which we cover many subjects. It is interactive. So we learn about palliative care. There's a session on the role of the volunteer, and of course, everything that's needed, his supervision, the support group, and all those things. Then we have a session on communication skills. We have another one done by our doctors and nurses about the diseases and the therapies that are available to understand better what our patients are going through. We have another one about the families and the relatives and what they're dealing with. We have sessions on grief and bereavement. We do have a bereavement support program which started in 2015. We have one on self-care, which of course is very important. I'm sure I'm forgetting some of the other subjects, but so we cover all those subjects that are needed for our patients, and it's always sort of a theory in the beginning presented generally by a professional, and then we do some exercises together afterwards to really understand the material better and to bond as a group as well.
Thank you very much for your answer. Let me read another remark in the chat. I would organize a charitable event, money raising or fundraising event, a fair or something. I would engage people through social media, and I would get in contact with those people who are not impartial, and then I would plan my first activities with future volunteers. Thank you, Yekaterina. And that's good that it's very good to organize an event or something positive. And it's really very important to understand who you will work with in future, because human resource is your core resource, and it's great if you have people that live nearby and they are interested because they're part of the community. And yes, I fully agree with you, Katya. I hope Carolyn agrees as well. Well, okay. So Ksenia is also writing that you can launch targeted advertising for the neighbors. Yes, that may work for social media. You can promote, or as Ksenia writes, advertise yourself. But what also works well, that is the word of mouth. And if some of the neighbors or their relatives happen to finish their life in the hospice, and that was a good experience. Many people are ready to come and help. That is exactly how it works really often. It's a human factor. We can do a lot of good things, but you know, the word of mouth really is something what is a very good tool of promotion for us, so to say. All right, we have the next slide. Let's move on, and I will wrap up. Okay, so this is a rough rough schedule. Of course, it's a draft one, and you can see and think what you could do, how you could break down your activities per month, per weeks, per every 6 months. How can you tap into this huge deal of work? As Ksenia said, you need to think who you have to come to agreements with, think of the legal aspects and potential legal issues you may encounter, and search, select, train. That is something what Carolyn has covered. You need to understand what you're going to train, because today we said why we need volunteers, but when you understand your needs, you understand what you're going to train, because you want your volunteers to take your volunteers outdoors. They need to know minimum basic safety standards. They need to understand how they can help the patients to walk around and so on. Or if they're going to do to help with home care, they need to understand what they can do while they visit their patients at home, and then first launch and adjustments, that is month 3. You may come up with a fundraising event, and it could be your first launch, and you can see how the volunteers will feel at your hospice. And fundraising events may become frequent, and of course, sometimes volunteers may find it a bit daunting to have the first contact with the patient, but it is so important, and you need to be there. And of course, I'm just giving examples. Your experience can go in an entirely different way. Address your questions to us. We'll be happy to answer any. And we understand that we may now talk in a bit abstract terms, but I'm sure that you will be able to streamline your activities. Now let's move on to the following slide and look around and see who can be your soulmate, who can support you. And the new question to you sounds as follows. We'd like to find out, you need to find out who or which of your colleagues can support you. Do you already have potential partners or allies? And think if is there anyone around who is interested in volunteers? This could be decision makers or managers. And of course, I understand that if you are here, you have this need. If you have been asked for this 4 sessions, but think about those who work with you. We have
Маленький комментарий, Феликс.
Ksenia has written a
На
comment.
самом деле,
Actually, yeah, go ahead.
да, я
Uh,
сказала,
well,
что мы хоть
you know,
Paste
I
занимаемся
have said that
образованием,
we
да, у
as
нас
Spaced, we
нет
provide
своих
some
хосписов,
training
fundraising
or
службы.
educational
Мы
events.
немножечко
We don't have
по-другое,
a
но у нас там
hospice, we are
есть
about
волонтеры.
something
Но,
different, but we
например,
also
если
have
бы
volunteers.
я
But for instance, let's
открывала
say
волонтерское
if I
направление в
opened
Paste,
or
я бы
launch a
пришла бы
volunteer
к
service at
партнерам,
Paste,
с кем
I
мы в
would
Paste работаем, и попросила
contact
бы
our
распространить
partners
информацию.
and I would ask
То
them
есть то,
to
как мы делаем,
spread
в
the
принципе,
message.
с
And that is
любыми
exactly
анонсами
what we
или с
do as we
любыми запросами
prepare
на
any
помощь, мне
event or
кажется, что можно
as we
посмотреть
process
внутри
any request
хосписа,
for
и можно
help. So you can
посмотреть,
look
какой опыт
around,
у
you
ваших
can see
партнеров, кто
what's going
может
on
вообще
inside the
быть
hospice
тем,
and
кто
who are
рассказывает
your
о вас
partners or who
истории.
might be your our partners
Like
and
who
who
would be
can
the one who
share
will
the
tell
message.
histories about you? Well,
Yes.
perhaps
Okay.
I think
All
yes,
right.
because somehow you
Yeah,
will
you
need
do
to
need
tell
to
about
talk about
yourself
yourself so
for the
others
others to
would
come to you.
contact you.
Karen, the question is now to you. We understand that you have the other experience, but when you tell about the trust, that it's important that you have trust, what is your basis to get the trust? So, whom do you refer to from the staff to get the basic trust in organization of the help?
Sorry, shall I answer that? Is that I'm sorry, I didn't understand.
Yes, it's for
Okay.
you. Like, who are
Okay.
the ones who
Yes.
from whom you are getting the trust? For example, when you started
Yes.
your volunteer service in Galilee,
Yes.
what was the basis? Like, who was your colleague? Because yes, you had a group. Perhaps more of the nurses were there involved in this,
Right.
or more directors, or administrative part, or these were the volunteers with whom you done it together, so to say. You tried to organize this all.
So the winning the trust for me was not the management because they already supported the volunteers and were familiar with that. It was more the professional team, the interdisciplinary team, which just simply wasn't as familiar with the idea of volunteering. They hadn't worked with volunteers before. And of course, we're talking about a vulnerable population of patients and their families. And so I think there was concern and it wasn't easy for them to trust us. So in addition to inviting them to participate in the training so that they would understand that this is indeed a professional and rigorous training, we also let them know that there is close supervision and that we also have a support group once a month, which our team psychologist also attends and participates in that is just for the volunteers who are working closely with patients and families, not the ones who are doing bazaars and other things. So I think, yeah, over time, we certainly, there was trust, and I think there were some people who it was easier from. The psychologist was one, and some nurses, but it just takes some time and doing a good job of what you're doing as volunteers to convince people that this is a good thing for everybody. And I think as far as the volunteers, it's not difficult to find volunteers. In my experience, there's lots of people who want to come, but they're not all appropriate. And there needs to be an important screening process. I would do an individual meeting with each potential person who wanted to be a volunteer. They would fill out a form, and we had certain rules. If somebody had been through a serious illness recently, or if someone in their family had cancer, we would not accept them for their own sake. It would be difficult for them. And that holds true, I believe, in England and the States as well, as a rule. But some other people too, you can tell sometimes if somebody's going to have trouble working in a team. So not everyone who applies is necessarily going to be received. And for me, part of the problem with using social media is that it's kind of a shot in the dark. You don't know these people. Many times they live far away, so they may not actually be that available for all those jobs that they may be happy to do. So it's only in the last 2 years that we've started putting something on social media, but actually very few volunteers came that way. They come more either through people who they know at Galilee, or from talks that we give, especially the first years. We would go out and give many talks about palliative care, and I would also talk about volunteers. So most of them came in that route. Thank you.
Yeah, great. Thank you so much. And by the way, this is a very important and interesting experience. And but still, how do you have the retention? We are out of the topic here, but it's very important topic. So how do you support the retention of the volunteers if you do not make a huge targeted group of volunteers? Then it is smaller. Yes, these are the friends, a huge group, collective, united by an idea. But how do you have the retention? Or they do not leave you from the beginning?
Yes, we do have a very good retention rate, and I think part of that is that everyone today is seeking community, and many of the volunteers just feel that they have found their community. So they really enjoy being together, and we will have an excursion all together. We have continuing education several times a year for the people who are already volunteers. And we're talking now about 10 teams of volunteers who have passed through the training since we opened in 2010. So it's not just the original group. More people come every other year. We train another group. This past year, we trained our 10th group of volunteers. So we're now almost 150 volunteers, and some more active than others. But generally, people really find meaning in what they're doing. They find a lot of meaning in the fellowship that we have together as volunteers. And I think that that's very important. And another reason that you need people who are not coming from very far away, because they won't really feel part of things, I think. Yeah, I don't know if that answers your questions.
But I think you've answered more than I really was thinking about, because I understand now your strategy here. Thank you for this. And we have a huge message. Xenia translated this, but again, I will read it out. Today, we look at the question like how we could better balance the necessities and the staff of the volunteers, because mainly our volunteers are working in visiting of patients, and there are young volunteers who want really to be in a direct contact with patients, but psychologically they are not mature, not ready to work with this, because the coordination of volunteers is made by a psychosocial team. It's a challenge to have an efficient management of volunteers. Therefore, I look into an idea that one volunteer who is more experienced would be a coordinator for young participants, so to say. I think, by the way, there are some pluses and minuses. Caroline, I wanted to
логично
ask you about
вводить
this. So
в
logically
какого-то
is
волонтера-наставника,
to make an
который мог бы
entry of
управлять
a
и
certain
направлять
elder volunteer
волонтеров.
who would be the guiding star or
Очень
who
верно.
would
И многие
have a
координаторы
counseling
волонтеров
for the
из
volunteers.
моих
And
коллег это
many
бывшие
coordinators
очень
of
опытные
volunteers from my
волонтеры,
colleagues are
которые как бы
pretty
доросли
much
до того
the
уровня, когда
experienced
они могут
volunteers who
даже
could
сами
grow up to
работать.
the level
Вот.
where
Я,
they
наверное,
could
тоже
work
один из
professionally here.
представителей
And I would
демократической
say this is
среды.
also a part
Возможно,
of my
похожий.
way here because
Но
my experience is pretty
вопрос,
similar.
есть
But the
опытный
question
волонтер,
is,
а есть
so
вопрос,
there is
насколько
the
собраны все
experienced volunteer.
волонтеры. Вот
The
как бы
question
из
is,
моего
what
опыта.
are the
Потому
other
что есть,
volunteers? Are
да,
they really
опытные
not
волонтеры, но,
experienced,
возможно,
or
слишком
there could be a
в
some
них есть
experienced
какие-то...
volunteer who
Давайте
has
я расскажу про плохие кейсы. Были
certain
достаточно
issues? I will tell you about
нарциссические
the bad
люди,
case.
которые
There were some
попали на
narcissistic
волонтерство.
people who came
Они
to the volunteering.
хорошо помогают,
They
но
were
для
good
них
supporters,
их,
good
их
helpers,
я
but for
больше,
them,
чем
their
помощь.
personal
Им очень
I
важно
is
иметь
more
руку
than
власти,
support, than the
как и у
help.
меня были такие
They
опыты. И это надо
want
очень быть
to
внимательным в этом. И
manage
надо
this, but
очень,
for
очень
their
грамотно ставить
profit,
под
so to say,
границы, в
personal
частности,
profit. And
вот
you
я
have to put the
волонтер, который
borders, of course. Where is the
как бы
volunteer who is
волонтер-руководитель будет
the
помогать
volunteer
влиять.
leader
И
who
что
will
он все
really
равно волонтер,
support and
а
help
что
you
вы
in making
сотрудник,
something?
который
And like
отвечает за
there is
все,
the volunteer and
собственно,
you
за
are
вас,
the
это
staff,
вся
and there is the
юридическая помощь. Это
difference.
нужно
You
очень
are also
грамотно
legally bound
прописывать,
to
потому что
something
если вы это
more
не
than a
сделаете,
volunteer.
то, возможно,
And you
будут
have to
проблемы.
make an outline
Простите,
because
что
there could be
ответил,
a
возможно,
problem. I beg
короткий,
your
но это здесь
pardon,
комментарий
there
к
was
этому
too much of this,
какому-то
but
сообщению.
Karen, perhaps you will have a comment on this situation.
Yeah. Yeah, no, that's true. And I think it's one of the most important things is finding people who can work in a team. Not everybody's a team player. Some people want to use it as a platform for themselves, or they just can't get beyond themselves. And that's something that I think we've gotten good at looking out for when we do the interviews in the beginning, because many times you can spot such a person when you have an interview and the other person is doing all the talking and not interested in listening to what you have to say. You realize there may be a problem here. We do not have young volunteers, although in the States, kids start volunteering very young. Here in Greece, there's a law that says no one under the age of 18 can volunteer. And I think they have the idea that maybe they're being taken advantage of, or they're suspicious that maybe they're getting paid and but aren't paying their taxes. There's different things. They're not so familiar with volunteering, so we don't actually have young volunteers. And then the people, sort of, the 18 to 35. I mean, most people are working, so I think the average age of our volunteers is around 60, 62. We have some older and we have some younger. We do have a few young people actually quite a few young people who do work from their homes, for instance, office work, things on the computer, things like that people can do from their homes if they're working people, and they help out in other ways when they can. But those who are most available have retired, their kids have grown up, and so they tend to be, particularly women, although we have quite a few heroic men as well who participate, tend to be a little bit older.
Простите, что мы так остановились на
I
этом вопросе. Мне кажется,
beg your
важно об
pardon
этом
for
тоже
us staying
поговорить.
a little bit too long on this
Да, я
question, but it's
согласен с
important
Каролин
to speak
полностью.
about
Да,
this. And
есть очень
Caroline,
важная
I would
работа
agree with
команды,
you
очень
here
важно.
as to the teamwork. It's very important.
Наверное, хотел
You
бы
may not
заметить и посоветовать,
underestimate
наверное,
this. And again, I wanted
почему
to
человеком так...
speak.
То есть
Also, there is the
он настолько
question,
активен, почему
the
так
one
много
question.
времени?
So
Это
there is
тоже
an
вопрос
active
очень важен,
person.
потому что
If you are so active, why do you have so much time, for
люди
example?
часто
This is also
ищут себя в
important
этом,
question because very
этим
often
ассоциируют
people are
волонтерство,
looking
хосписе,
into this
например.
and
И это тоже
associate
не
only
совсем
with
правильно,
this
когда человек
themselves.
приходит
Like
каждый
I'm a
день
volunteer in
в
hospice, it's
хоспис
number
на
one.
3 часа
It's
там
not
за
the right
4
thing,
часа,
but
это тоже
every
звоночек,
day
потому что
there
что-то
is
не
one
так.
person comes to
Возможно, он был
3-4
прекрасен на
hours into the
собеседовании,
hospice.
но
Perhaps
когда он
it
каждый
would
день
be a
приходит, у
great
него нет
person, yes,
работы, значит, он
but
живет только этим.
has
Это
no
тоже
work,
вопрос
lives
очень
only with
большой.
this, and
И
this is
еще,
also a
конечно
huge
же,
topic, maybe a huge
из
topic,
моего
problem.
опыта, из того,
And
что
out of
было,
my
помощь
experience,
была, да, спасибо, помощь
yeah,
была
thank you
очень
for
всеобъемлющей для
supporting me
хосписов,
here. And out
от
of my experience, we had
консультантов
a
с
huge help
специалистами.
from peeling of
Очень важно,
potatoes, for
возможно,
example.
разделить
And there are some people who can
обязанности,
peel potatoes
то есть
very
если у
great.
вас
Why
есть, да,
not?
очень
They
маленькие
can help
задачи,
you
и,
here.
возможно,
There
там
are
есть будет
small tasks,
какой-то
really. And
главный
there in the
мотиватор.
small tasks,
На этой
there could
маленькой
be a
задаче или
queen or a
небольшой
king of the
аспекте.
small
Например,
tasks. And this is
работа... У
great
нас был
also.
зооуголок для животных.
Like
И
we
вот
had
там был
a
любитель
small
животных.
zoo.
Это был
And
один
there are
человек,
people who loved
и он только
animals. And
ими
there was
занимался и
one
курировал
guy
эту помощь
who
там.
was the
И
curator for animals, and
был
he
один
was
волонтер,
like
который
into
очень
this. And
любил
there was one
развозить
volunteer
еду,
who really loved
помогать
to deliver some food.
медсестре развозить еду по
Really, he
пациентам.
helped
И он
nurse
только
to
там
deliver some
занимался,
food
и
to the
кто-то
patients, and
приходил
this is what
помогать,
he done. And there are some people who wanted to help. They were the curators. And this is Yulia, and Yulia knows how to work this. Like, for example, she will tell you how to do it right. And as an example, and we do not give the full rights, the full ownership, so to say, full obligations, but still we delegate something for the guy to manifest himself or herself. Thank you, Carolyn. By the way, for the question also, it's important. I see that there could be a huge problem. Yeah. So we are a bit out of time. Perhaps we will cut down a little bit, but let us go on further. Thank you for listening. So steps, yes, and also an example here, where can you search for the resources for the participants? This is Yes Coordinator. If you have a coordinator, the one who is coordinated more of volunteers like Carolyn does, it's a great plus, it's great. Perhaps you will have to fight for this, the management, and say that we need this person, because without this person it will not work very well. Very often the staff takes this function, but again, it's not every time a great thing, because you can be a social worker, you have your work, and then you are coordinating volunteers. It's unfair a little bit. Therefore, the question is, you will have to speak to the management, like, we need this person. As the management of Carolyn told, yes, we need this function, we need somebody who will speak on behalf of this. And the heads of the clinics, of the hospice, could be also in union with you, because they can speak, they can comment, they can be skeptical, of course, but still they are at your side. And this is a huge plus for them, because social work is a huge plus for any organization. Staff, as Carolyn told today, without trust, you will not succeed. And partners also play a huge role, as our colleagues from Kazakhstan told, that they are partners, as I may read right now. Kazakh Association of Palliative Care Together Against Cancer is the name. The associations are helping organizations with partners, and they are partnering with organizations when it matters. Just to become a partner of a hospice. For example, in my case, it all was close, but hospice was one organization, and the organization when I worked and volunteers guiding organization was the other. And we had just an agreement, a framework, which helped us to make this work together. It helped us with working. And legally, there were different organizations. Yeah, so thank you for this. And now the next topic. Let us speak and think about resources. What are the resources that we have? Perhaps a little bit we forgot, we could forget something here. We will speak about this. Perhaps you will have some comments. We will be happy to read it in the chat. And Carolyn and Xenia, we will be able to speak about this with you. Because yes, this is
Социальные
also,
сети, о которых
yeah,
сегодня
a
много
blueprint. Social
говорили
networks. We've been speaking about social networks today. I will write it here, like social
социальные
networks
сети.
in the chat.
Мне кажется, а если
I
социальных
think,
сетей
yes,
нет, то
this one.
социальные
And if
сети ваших
you have no
партнеров,
social networks, then your
ваших
partners will have social
амбассадоров,
networks. Your ambassadors will have your
кого-то еще
social
тоже.
networks.
Или, может
Somebody
быть,
else more.
вот
Or perhaps,
я жила в России, и я
like I
знаю,
used
что
to live
очень
in
хорошо
Russia, and I
развито
know that there is the great
добрососедство такое, очень хорошо
uh,
развиты какие-то локальные
like
чаты,
support, local
группы в
support and local
Фейсбуке, в
chats, like
Инстаграме,
Facebook groups,
как-то еще.
chats
То есть
of
любые платформы,
neighborhood
где вы
watch and
можете
so on.
рассказывать о себе,
There
это
are
тоже
many
ресурсы,
platforms
мне
where you can
кажется.
tell about yourself, and this is also a resource. We did not speak about this, Carolyn. I wanted to ask you about resources, Carolyn. We've been speaking about social networks, about support of the leadership, but the question is about the church, because you are very close in cooperation with the church, as I can remember. Does it affect? Is this also a resource, like you have to help hospice because this is the good will, the will of the God, so to say? Yeah.
You know, I think that there's just a certain trust. Our bishop was the one who started the hospice. He's a metropolitan, and he's a very highly educated and very well-loved person. So I think he has opened up many doors for us because he already has people's trust and respect. So that has been very helpful, and he's been very active in advocating as well for palliative care here in Greece. He's in charge of the bioethics committee of the church for Greece. So we're very fortunate to have him. There's no question about it. That's fantastic. And we do have Legal support, we don't have an in-house person, but we have lawyers that we turn to when we need to. We don't need many materials really for it's kind of minimalistic. I mean, as long as you have a screen and you can show your programs to the volunteers in the training, you don't need a lot more than that. So I feel that we are very blessed here. It's definitely easier than starting somewhere where you don't have somebody out front kind of opening the way for you.
Согласен, спасибо.
I would agree here.
Да,
Yeah, thank you so much.
вопрос о
As to the
юристы
question,
волонтеры или это все-таки
the legal
организация?
specialists
Просто
that you
есть
are
такие
telling, are
представители
there
от
the
юристов.
volunteers? Because we
В
have
вашем
some
случае это
volunteers who are legal
юристы, или
specialists,
это
or are they
просто
from
нет организации?
organization? Are they
Это
paid
важно.
by
Простите,
your
что спрашиваю,
entity?
просто
I
интересно.
beg your pardon for asking this, but this is also
Yes, no, that's fine. We do have some volunteers who are lawyers or because notary public, and they will sometimes help in some circumstances. But when it has something to do with the Galilee Palliative Care Centre, we have somebody who's not paid, just out of love and caring and his relationship probably with our director. He gives us advice for free.
Мгм.
Yes, yeah, and he's very trustworthy. Yes.
Спасибо. Спасибо. Нет,
Thank you
просто
so much.
интересно, да, я понимаю, что да,
It was
личная
just very
связь, я думаю, что
interesting. I
это
understand that personal
это
connection
очень
plays a
важно.
huge role
Хорошо, да.
at any time, but
Возвращаясь к нашим
still,
ресурсам,
there was this question.
для меня,
And speaking
например,
about your
да, время
resources,
это очень важный
for
ресурс.
me,
Всем
time
обычно
is
волонтеров
a
нет
very
ресурсов,
important
никто
resource.
не
If
придет.
volunteers have
Это
no
может быть
time, they will not
постоянность
just come
и
to you. Therefore,
разговоры и все
we have to
остальное,
make
скажите,
some
очень
collection of
необходимо
time,
для
so to say. We need to understand where it will
наших
fit for
волонтеров.
the volunteers, and we will
Материалы, как
need to speak about the
мы уже
volunteers.
говорили
Also,
несколько раз, да, про
materials,
обучение
as we told about the training with
и
the
про
colleagues.
документы, поддержку
Also, the
юриста-бухгалтера.
documents, support of
Да,
a
конечно, потому что
bookkeeper,
я сколько
of
раз
legal
имел
specialist, and yes,
общение, я
indeed,
думаю, что
because
Каролин
many
подтвердит,
times
с
I
юристом,
had
то есть ли договор верный, какую запятую
some
стоит поменять,
talks with the
все ли
legal
там договор
person, like what
правильно,
do we
и
need
тебе
to
присылают кучу
change, to check, is it okay,
изменений,
corrected
что все лучше
in
сделать
the
так, потому
contract,
что
and the
родители
legal
говорить правду.
specialist will
Я
say,
такой, да,
yeah,
это
it will
правильно, спасибо.
do
Да,
А
это
еще,
better
очень
when you
Феликс,
will make some
может
changes.
появиться
And
Ah.
Felix, by
волонтер,
the
который
way, there
переводит
could
с
be some
юридического
volunteer who
языка
is
на нормальный.
translating from legal language to a normal
Не,
language,
вообще есть такая вещь, как
which is also
волонтеры-переводчики.
important.
Это
Yeah,
прям
there are some
первый
volunteers,
юридический способ
translators,
общения с нашим
interpreters,
американским
great
переводит.
people. By the way,
Вот,
thank you
что их
to the
профессия,
interpreters
я
who
считаю,
are
действительно
working here,
важна, и
because their
даже
profession is
паллиативный в
also
том числе.
playing a
И
role
это
even
тоже
in
не делается.
palliative care. You may
Поэтому, да,
not
и
do
очень
anything without it.
профессиональные волонтеры
Again,
важны.
professional volunteers with their
И, в
profession,
общем,
they are really
с
necessary,
информационной
very
поддержкой, как мы
important.
рассказали,
And as to
как
information
социальные
support,
сети, конечно
also
же,
like
без
informational
них не можем.
backup by
Хотя
social
вот
networks. Without social
в случае
networks, we
Каролин
may not
настолько все
really
наработано,
exist today.
что
But in
можно
case of
добавить
Karen,
фидбик,
it's
но все
working
равно не
like this that
справится.
you may
То
not
есть все равно, мне
work.
кажется, в
You
наших
may even
реалиях
work without
мы
social
не
networks.
можем
But still,
пока
I think in
произвести.
our case, we
Спасибо.
have to have some
Мы
social
прошлись по
networks. So thank you so much. We had
небольшим аспектам, хотя
4
все
pillars,
говорить
4
можно бесконечно. Мне
aspects.
кажется, я
But
бы еще
again,
и
you may
час бы
speak
про каждый
about
говорил бы. Давайте
every
перейдем
aspect
дальше
at least plus 1 hour.
и
So
немножко
let us
так,
switch further. And now,
да, немножко поговорим с вами про и у Кэролин спросим, потому что мы можем сейчас, мы уже приступили и
Okay,
стали
Carolyn, let
обсуждать
us ask you about the
немножко ваши
following. We
индивидуальные
already
проблемы и
have
вообще
started
как
discussing
можно
individual
разделить
problems of our
каждый
attendees,
план
and we are
и
seeing
как
how you can
каждую
link your
организационность.
plan
Есть
to
индивидуальные особенности.
your work,
И
and
это
of
очень важно
course,
учитывать, потому что мы
uh,
можем делать любой
you
прекрасный
have
план,
to
но без
kind of
индивидуальных
customize
особенностей
it
мы не
because of
сможем
course you can come up with
ничего
any
сделать.
plan and you
Поэтому
can
сейчас бы
we
хотел,
can give it to you,
мы
but
уже,
of course
мне
it has
кажется,
to be
у
customized
Кэролин
for your
спрашивали, но
needs.
хотел
And
бы еще раз
we already have asked
хотел
you,
бы вас
Carolyn,
уточнить,
about this,
какие
but let me
индивидуальные
ask
особенности
you
Греции
again,
для вас
what are the
были,
individual needs of the
что именно для вас в
hospice in
организации
Greece
Греции
did you encounter, and
нужно было адаптировать из вашего
what did you
опыта,
have to
как эта
adapt
работа
for that
выстраивалась,
local hospice, and what did you do as you
если есть
joined
вопрос.
it?
Well, ours is private. As I said, there's no public support from the government at all, or money. I think once, many years ago, the parliament donated a car for home care, but since then, nothing else. So in some ways, when it's private, you can make more decisions on your own. So there is a certain freedom, I think, in it being private. But of course, you're deprived of a great deal of support, which would be hugely useful. And in fact, it's such a shame because it would be in the interest of the whole public health care system to implement palliative care in the hospitals, have a wing in each hospital that offers palliative care. It would be in the interest of the people, of the government, financially from every point of view, but they're not ready for that, I guess. So, and as far as legislation, it's been pretty frustrating. They did pass a law recognizing the need for palliative care, I think in 22, but nothing has been done since then to implement that law. And we have our scientific director, together with other people, working very hard on this. There's a lot of goodwill there. It's just things are kind of sticky and slow. So we're not able actually to put a sign out front saying that this is Galilee Palliative Care Center. We cannot do that legally, even though everyone knows that that's what we are. And so there are problems like that here, as I'm sure there are in other countries. As far as the team and the resources, you're talking about the volunteer team? I'm not sure what the question is there.
If you can talk about the volunteer team, that would be great. But maybe you could just talk about specifics of the work in your particular hospital. So maybe something unique that you have come across.
Our work in the hospice. I'm sorry, I didn't hear. Or did you say?
Yes, in the hospice. That's right.
Okay, so from the beginning, it was all home care team, and it was specifically for cancer patients. In 2000, because we just didn't have a huge team, so it had to be somewhat limited. So it was for people with cancer. In 2015, we started also caring for people with Lou Gehrig's disease, the motor neuron ALS disease. And there are quite a few. So these are all home care, so they all have to be within the area that the hospice is in. It's a very large area, the metropolis. And we also had just recently, we've started taking people with Parkinson's as well. As I said, back in 2011, we started the daycare. So we have daycare as well, which has been very popular. It started 1 day a week, 2 days a week. This is run by volunteers, and many volunteers participate in that and have all kinds of interesting programs for them. It's really nice. Many people are kind of stuck home alone with their families working, or they just don't have anyone there with them. So it's wonderful for them to come and sing songs, have a meal. We have a little hairdressing salon. So it's a wonderful experience for them. So that continues. And in 2018, we opened the hospice, which has 9 beds. And the people can come there for about 15 days at a time, mostly to get their symptoms under control. If it's at the end of life, then there's of course some flexibility in how many days they can stay. And for the hospice specifically, it's open to anybody in the larger Athens area, which of course is 4 million people. We definitely need more hospices. But for now, this is what we have. And so that's really wonderful work. It's the only hospice in Greece still, though there is definitely interest in developing that more by various individuals. So I think as far as the cultural context both for volunteers and for palliative care, it has a big impact on all of us. And as I have explained, it's not very well known. Palliative care is not very well known in Greece. There is a very good master's program which at the nursing school, which is interdisciplinary. So doctors, nurses, social workers, psychologists can all follow that. And that has been very important. Galilee also does a lot of educational work. We have a seminar every year for healthcare professionals. And we now, since COVID, we've been doing it on Zoom, so people can actually participate from all over the country, and some people even from Cyprus or from other countries as well. So that's very important, just training and teaching more and more people about palliative care. And as far as the volunteers, as I said, there's some limitations. They're not good understanding of volunteering here in Greece. I believe that will be changing though. Yeah.
Caroline, спасибо
Carolyn, thank
большое.
you
И я
so
бы
very
хотела
much.
обратиться к нашим
And now I
участникам
would
в
like to
чате.
ask our attendees.
Я знаю, что у нас участники
I know that
из Казахстана,
we
из
have
участников из
here
Армении,
attendees
из
from
Египта.
Kazakhstan, from
Если вы
Armenia,
можете
even from
написать в
Egypt.
чате, а
If
какие
you can
особенности
write a few words in
есть
the
в вашем
chat
хосписе,
regarding
и
the
поделиться с нами,
specifics
мы
of
будем очень рады.
your work in
При
your
этом
hospices, that
современные
would be
технологии
great.
нам
We
позволяют
understand that
переводить на любой
modern
язык, поэтому если вам
technologies
быстрее
help us
написать на
do
армянском
automatic
или на
translation. So
казахском,
you can
мы с
write in
большим
Kazakh language or
удовольствием
Armenian
очень
language.
быстро
That's
переведем на
fine. We
английский и
will
русский язык.
translate your messages
Поэтому
from any
поделитесь,
language into
пожалуйста,
English,
в
into
чате
Russian.
или можно
So
даже
please
включить
share
микрофон
your ideas in the chat or
голосом,
join
чтобы
us,
сказать,
unmute
если у
yourselves
кого-то
and
из участников,
share
из наших
ideas
есть
if
возможность
you
включить
feel like doing
микрофон,
so, of
пожалуйста,
course.
включайте
So
тоже.
does anyone
Делитесь с
feel
нами
like saying a
вашими
few words?
историями.
Could you share anything? What is of particular interest for you?
Мы пока подождем, пока
Well,
участники
we are
поделятся
waiting
спецификой работы
for
в
your
чате.
messages. So tell us
Кэролин, очень важный
uh,
момент
what is
осветила про
specific. And
культурный
it was
контекст,
really great to
когда
hear from
мы делаем
Carolyn
различные образовательные
uh,
программы для стран, где
about
мы
the
работаем с
cultural
Grace.
context.
И,
Whenever we
естественно, тоже
prepare
имеем в
programs for
виду
various countries that we
культурные,
cover as part of PACE
различные
efforts, we
религиозные
take into
аспекты. И
account the
нам всегда
cultural,
очень
religious
интересно
aspects.
узнать
And of
больше
course, it's
про
very interesting for
ваши
us to
страны,
learn
про ваши
more
города.
about your countries, about
К примеру, я
locations of your
помню, что
presence.
коллеги
For
из
instance,
Грузии
I
делились
remember
тем,
our
что
Georgian
помимо
colleagues
грузинского
were
языка
saying that
есть еще локальные
apart
языки,
from the Georgian
и
language,
им
there
бы
are
не
some
помешали
local
волонтеры,
dialects,
которые смогли бы и
and it
переводить
would be
на грузинский
great
язык, когда к ним
uh,
обращается
to have
какая-то семья,
volunteers
которая едет,
who would help
приехала
to
к ним издалека,
provide
возможно, из какого-то
translation
маленького
services
села в горах.
into
Вот я
Georgian
помню, с
language
вами
because
тоже наши
sometimes
коллеги из
uh,
Грузии делились. Сегодня много
families bring their
вспоминаем
relatives, their patients from
наших
remote
коллег из
areas in
Грузии.
Georgia,
Думаю,
and
что
they
еще
might
дополните.
need
Да,
some
да, спасибо, Ксюша, и
translation,
спасибо,
help
Каролин,
with translation. Thank
за
you, Ksyusha,
свой
and
опыт. Я могу сказать,
thank you,
что,
Carolyn. What
да,
I
ну,
can say on my
если
part,
говорить тоже по такой же структуре,
again, if we move
чем
along the
учреждение,
same
я работал на
structure,
хосписе, и это,
I
конечно же, очень
were
сильно помогает, потому что, ну,
I
во-первых,
work in the
это
hospice, and that is very
стационарный
helpful
хоспис,
for me. It
где
is
ты можешь
a
поставить свои правила,
hospice, a
свои
hospital-based
возможности
hospice,
и
and yes,
помещения даже,
y-
и где есть сам дух
we
хосписа, где тоже легче тренировать волонтеров,
we can
раскрывать их мозги
provide the
сразу же, на
training
них всех
programs, and
образовывать.
we have
Есть
beds, and we can
тумбочки, где
show
можно же тоже посмотреть, как они
what
правильно работают.
manipulations they can
Есть
do
возможность
and how
показать
they can help in terms
кормление пациентов
of
на
feeding
волонтерах
the
или кровати,
patient,
как это
and
сделать правильно. Есть, конечно,
so it
имплементация в
is
хосписе, когда
like
ты
on the
работаешь,
job,
это, конечно
kind
же,
of on the
очень,
job training.
очень облегчает. И когда
And of
сами
course,
стены
when you
идут
work
вот этим, это,
and
конечно же,
provide
очень
training out
важно.
of hospice,
По
it's
поводу
really good, and you can
законодательства,
get the feel of the
где работаю
spirit.
с
As
людьми,
for
больше
the
специалисты могут,
legal
конечно,
issues,
сказать
and
опыт. Есть, знаю другие опыты, но всегда не
I
так. То есть
used to
не весь
work
опыт,
in
можно сказать, о
Russia,
волонтерстве,
and in
но
Russia there is a
она, с одной
law
стороны, иногда
on
все-таки
volunteering
мешает, что-то
services, but
помогает.
sometimes it's
Это
not
без
really
проблемы.
helpful.
Есть
On the
желание
contrary,
очень
it can
часто.
impede you from doing many
То,
things.
с чем я
And
сталкивался, то,
what
что,
I
может
have
быть,
come across,
у вас не будет
and I
сталкиваться, когда
hopefully you
ужасно
won't
хочется вашу
have
базу
the same
волонтеров
problems
по
when
какой-то причине, потому что это волонтеры,
and
и
the
мы
process,
хотим тоже их
what I'm talking
использовать
about
для
is the
каких-то,
providing
ну, там,
databases
не
of
знаю, есть, в общем,
volunteers or
представители
volunteers'
ОФОН,
data.
и они
Let's
хотят
say
каких-то
that
волонтеров, которые очень активны. Давайте мы тоже будем на них делать рассылку
uh,
самые, наверное,
the
простые истории.
yeah, the government
Вот. И
wants
надо объединять
to
и
run a
передавать,
public
потому
event
что это
like a
личные данные,
marathon,
и есть
and
закон о
they
личных данных, и это,
uh,
конечно, каждый раз некоторые
demand private data
очень
of
странные
our
рассуждения, когда
volunteers to them.
уже
And of
положен
course,
закон,
we have
и
to say
каждый раз
no because that's a
пытаешься
private
видеть
data.
какие-то
And
выпады.
of course, there are lots
Да,
of legal
профессиональные
hurdles.
ресурсы,
As for the
профессиональные
resources and
ресурсы,
the
это
teams,
интересно с точки
well,
зрения
that's really
того,
interesting.
что
And
в моем случае
in my
было,
case,
мне кажется, даже слишком много ресурсов, потому
there
что
were way too many resources,
я
I
был
can
в
put
большом
it this
городе,
way. I used
и вот то,
to
что говорит
operate
Кэролин о том,
from a large
что вы
city,
закрыли
and
доступ, и к вам приходят свои люди, у нас тоже была
Carolyn
большая
was
такой
uh,
такой
saying that people who join you, and that's good. And we had lots of people willing to join us. At the same time, there was a huge turnover. Sometimes people would want to join us once or twice. Maybe they wanted just to spend one day with us. But having them for one day is very resource intensive. You don't want a high turnover. You want to invest your time and effort in someone who will want to stay with you for a long time. Otherwise, it's very frustrating and sad. As for the cultural context, I can see a great deal of progress. And over the past 15 years, the volunteer movement has achieved a huge progress, a huge breakthrough, and I feel very positive about it. Although there may be some small negative aspects, but I won't dwell on them. I see the positive side that is huge, especially the significance of this movement for the palliative care. And sometimes it's interesting that there are so many people who want to come and help, even just for one day. But I'm thinking about it from the other angle, from the other perspective. Okay, these people come for one day, they eventually do not stay with us, but at least they saw the hospice, they got an idea what it is about. They understand that hospice is so helpful, it's so great to have, and their relatives may end up there as well one day. And I see a message from Sophia. Thank you very much. The majority of our patients do not have full information about their diagnosis, and therefore we hold a special training for volunteers in terms of treating this aspect with caution and great deal of sensitiveness. So how do you interact with a patient who does not obtain full information about his diagnosis? So what do we do? What would I say about it? There are cases. I'm not sure, Sophia, whether this is a common practice with you. Yes, some patients are not fully aware of their diagnosis or prognosis, and that is something what you always have to discuss with the volunteers. But again, it is not a volunteer's job. It is the medical professional job to communicate any information about their diagnosis to the patient and to the family. And it's a huge problem in the palliative care, I would say, because let's say a medical professional may not be willing to share this information or simply feel scared or afraid to share that. And there are different situations. And Actually, let me tell you the following. The volunteer should not know the patient diagnosis. This is private information. But in any case, we hold a session on that aspect. In our hospice, we had a system of signs, and by looking at the sign, you could understand what was going on with the patient. For instance, we had a patient like let's say food for a diabetic patient. That means that the patient would not offer anything sweet or containing sugar to that patient. Or for instance, there is a frail patient and you need to handle him with care because he can or she can fall down easily. Do you, Carolyn, have patients in your hospice who are not aware of their diagnosis or who do not have full information about diagnosis? And do you provide any training in this regard to the volunteers in terms of what they can or cannot say?
Yes. And I know that the professional team comes across this, that basically families, what the relatives may say to the doctor or nurse when they first come, he doesn't know what he has. We don't want him to know. Please don't say anything. And the policy of our team is basically, if the patient asks us, we will never tell him a lie. So if the patient wants to know, we will have to answer honestly. Aside from that, if he doesn't ask, we'll go along, with what you're saying. Now, with the volunteers, when we're working with somebody, we get a form filled out by the social worker, which gives us a little background on the patient. We do generally know the diagnosis. Of course, this is not all the volunteers who are working with patients. It's the ones who do home visits, perhaps do some transportation, and who are in daycare center. The patients themselves talk about it openly with us. So it's not something we would ever bring up. We do know it, but we are trained over and over again to be active listeners and to let the patient do most of the talking. So certainly we would not bring up such a subject, and that is part of our training, yes.
Да. Да, спасибо огромное,
Yes, thank
спасибо,
you.
Каролин,
Thank you,
огромное
Carolyn,
за
for
комментарий.
your
У нас
comment.
на самом деле есть еще
Actually,
несколько упражнений, но,
we have a
но мы
few
смотрим на время, и мы правда
questions or
много говорили.
exercises,
Да, и мы
and
даже с
indeed we
Каролин
are
договорились, что у нас
today
будет
active
всего,
talkers,
чуть меньше,
not so much listeners. And
меньше разговоров,
actually,
но
initially we were
получилось так, что очень
discussing this
интересно вас
with Carolyn,
поспрашивать. Спасибо огромное, что
thinking
вы
that we should
на
give
все
the floor to our
отвечаете.
attendees. But
Да, и
it's
поэтому
really
мы понимаем,
interesting to
что у
listen
вас
to you,
очень
Carolyn. Thank you for
загруженный
giving these candid
у всех у
answers.
нас,
And
и
we
в
understand that
частности
all
наших
of us
участников, очень
have a
загруженный
very
рабочий день,
busy
поэтому мы уже
schedule.
будем потихонечку
And I
завершать
think we will wrap up little by little,
нашу сессию.
wrap up
Ульяна,
our
можешь ли ты
session. Uliana,
нажать на следующий слайд?
can you go to the
Да,
next
это
slide, please?
мы послушали, да, спасибо. Да, следующий.
That is what we have
Да,
discussed
давайте
already.
это переведем, это занятие, это задание
So
переведем в формат
this
домашнего
is
задания. У
an
нас, как
exercise
мы уже
for your
говорили, будет
homework.
еще одна сессия
As
бонусная
we said, we will
через
provide you
в
with a
следующем
bonus
месяце,
session that will take place
23-24 октября.
next year.
Поэтому
Next
мы
month on the
отправим все
23rd
домашние
of
задания вам в
October,
чат
and we
и на
will
почту.
send this
Но
homework to
давайте
your chat.
подумаем над
But
структурой,
let's think about the
вашей
structure
мини-презентации.
of
Она,
your
возможно,
mini
даже нужна для вас,
presentation.
чтобы вы сами
Actually, this
попробовали
structure will be
вообще
helpful for you. So think
проадвокатировать эту идею волонтерства
what
для себя и для
you
вашей
can
организации. Там
do
все достаточно
to
просто.
promote the idea of
Вам
volunteering
нужно какую-нибудь
services for
проблему
your
конкретную, как мы уже сегодня обсуждали
organization.
много
So
раз.
identify a
Что меняет
problem
программа, для чего она
and
нужна.
think
Выгоды для учреждения,
why
какую
do you
выгоду вы
need this program?
получаете,
What
в
can it
принципе, как,
change? What
как мы
would
это
be the
организуем.
benefit
Опять сегодня
for your
обсуждали. Я думаю, что надо
institution?
просто попробовать
And
с листочком бумаги и с ручкой.
think
Давайте подумать.
what
И что нужно
you
от
could put
руководства.
down
Это
here
тоже
and
будет важная
what
пятая
you
часть,
would
потому
like
что
to get from
как
the
мы из опыта из одного,
management.
из опыта
It's
Кэролин,
very
руководство никаких не
important. And
получится.
of course, you
Здесь
cannot
тоже
go
нужно
too
подумать.
far without the
Да, это
manager's
такое у нас домашнее
management
задание.
support.
Мы его, еще раз говорю, вышлем вам в чат и на почту.
This is the
И давайте
homework. We will send it
подумаем,
to you in the
наверное,
chat and on your email. And
над
let us
бонусом день,
think
который состоится
about
23
it
октября,
on
через
the
2
bonus
недельки.
track on
Спасибо.
23rd
Так,
of
можно,
October.
наверное,
Again, I am repeating
нажимать.
myself here.
Да,
So
это
basically,
мы
you
оставили на домашнее
may
задание.
show it
Да,
as the
еще раз,
homework for you
да, еще раз
and
давайте
more.
подведем итоги, будем подводить уже
Again,
итоги
at
нашего
the end of
курса
our today's
из
course,
4 частей.
we are saying
Мы
that we had
прошли
4
их, мы
parts up to
обсуждали,
today.
зачем нужны
We've been
волонтеры,
speaking
очень
why
подробно
volunteers are
говорили,
needed,
что, мне кажется,
really in
очень важно, как и
details.
юридические
I think
вопросы,
we were speaking about all legal
основных
issues and
вещей,
foundations.
и
I
другие
think
никуда не
one of the
деться. И у
basics
нас
is
есть
this,
запись, я
and
думаю,
you
что
may
еще
not
раз можно
do
посмотреть, и
anything here.
Layla
And we
прекрасно
have also the
объяснит.
footage of this, and
Мы
Layla
говорили
told us
про роль
about it.
границы,
We've
и
been speaking about
смотрели это
rules,
на базе
boundaries, and
Сент-Кристофера
on the
хосписа,
basis of St. Christopher
один из
Hospice,
старейших хосписов
which is one of the
и
oldest
опытнейших хосписов в мире.
hospices
И
and
сегодня
very
мы
experienced
обсуждали
hospice
план.
in the world. And today we've been
Мне
speaking
кажется,
about the
очень,
plan, and I think
он очень абстрактный, но мне
launch
кажется, в
plan is an
контексте
abstract
конференции про
thing,
очень
but
важные точки, на которые
it's
нужно
very
обращать
important.
внимание.
There are some
Даже
points where
если у
you
вас
have to
уже есть
pay
ваша
attention to.
служба,
And
про то, что мы
even
сегодня
if
говорили
you
на
have a
примерах, очень
service,
важно,
we've been
возможно,
speaking about the
посмотреть еще
examples.
раз,
Perhaps
точно ли
it would be very
вы,
useful for
если
you
у вас
just to look at it, like,
эти части
do
работы
you
в
have
вашей
these parts
работе.
of the work
Да,
in your
спасибо.
work?
Поэтому, да, можно
So
дальше.
basically, next
Так.
step would be your first
Да,
step.
можно подумать еще
Let
над
us think
дополнением,
about your
мы
first
уже
step
обсуждали
as
это,
an
чтобы вы
add-on. We've
попробовали
been speaking about
на
this
следующей неделе
already.
сделать.
What
Даже
would you
маленький
do in
шаг,
the next
честно,
week?
очень-очень
Even a
очень
small
важен.
step is a great,
Даже
it
какая-то
is a step.
маленькая вещь,
Even a small
уже
thing
по себе знаю,
would
например,
do,
что
would
если
play
я,
its role, because I know it on my
если я
experience.
руковожу
If
что-то за
I
рутину свою,
am
это
including
происходит
something into my
показано. Поэтому
routine,
подумайте, что
like
вы
drop
видите.
by drop,
Так,
stop by stop,
идем
I
дальше.
am getting to a
Можете
certain
возвращаться,
result.
переживайте.
And
Да,
here
еще раз
we are
поздравляю вас за
finalizing
встречу.
our today's meeting. We are
Поделимся первыми
announcing now a
результатами и
bonus meeting.
посмотрим на
We
наше
will
домашнее
have some
задание.
results. We
У
will
нас, еще раз
show
напомню,
on the
23
homework
октября,
on the
12
23rd of
Опять
October,
же, мы вам все вышлем,
12
все ссылки. И
CET.
сейчас у нас будет такой перерыв в нашем
You will
курсе.
get some links and we will have a
Далее.
small break in our course. And further on, we have our chat. Please do write anything you want into the WhatsApp chat. Share your experience with the colleagues. It's valuable. And tell us about your ideas also. Together with Ksenia, I am there, and we're at every time happy to get any feedback from you. And also, now we're finalizing, like a final word. You have the map and the compass. Do use the possibility to make a first step. Please do it. And go to your goals. We need to have all the volunteers. We may be volunteers by ourselves, but the main goal is that the hospice will get volunteers and will help the patients. Caroline, do you have any ideas perhaps or final ideas for the final word, so to say?
I would just say it's a real joy for me to be here with you all. It's so exciting to think of in all these different places, volunteer services being developed. It's so needed. It's a very special experience for the volunteers as well. We've all learned so much, felt so much. It changes your perspective on life in so many ways. We've all found wonderful new friends. We have a wonderful sense of community here. I feel very blessed because both my parents died in palliative care, and so it was very important to me to somehow participate in that out of gratitude for everything that they received at the end of life, and it's what every person deserves. So yeah, I wish you all the very best. I think you're making a great beginning here with all this help and support and structure. It's fantastic. So happy to be a part of it. So wishing you all the best.
Thank you so much, Caroline. Thank you for this encouraging, inspiring works, and thank you for your precious time. It's all about your experience. And just a couple of final words from us. Thank you for being here. Thank you to everybody. Please be reminded, 23rd of October, put it into your calendar. Again, we have a great partner, the Grace Trust, which is supporting us. By the way, by means of this Grace Trust, we are realizing this treatment, the training. Thank you for this. And also, I wanted to say to everybody that we are giving their certificates. After this course, you will get your certificate. And finally, you will get a certificate if there is a mistake or something you failed to do it. So please write to the mail, and together with the team we will correct everything and you will get all the corrected data. If there are some mistakes, please be with us in the social networks. And thank you to the team, Caroline, to all the speakers, and on behalf of all of the speakers, we want to say thank you to Ksenia, Katya, thank you so much. Uliana, thank you for the technical support. And thank you to the interpreters. And again, we've been saying to the interpreters, thank you so much. Maxim Sirenko and Ksenia Ruzova, thank you for the interpreting. Thank you. So again, our ideas are made broader thanks to the interpreting. Thank you so much. We will meet you in 1 month. Shall you have any questions? Ask in the chat. Paste was online, is with you. And let us do more good things. Let's make palliative care better. Thank you. Thank you. Caroline, again, thank you so much. We will write you also later on. Thank you.
Я думаю, мы можем завершить для всех, да.
Да. И
Спасибо
давайте
большое.
встретимся. Спасибо. До свидания. Чао, Каролина.